Welcome to my channel. Glad to have you here. It's been several months since I first posted about the ongoing problems I've been seeing in the medical and fitness communities with the unlawful and unethical quote-unquote prescription of body protection compound BPC-157. BPC is a 15 amino acid synthetic peptide that is gaining popularity for its supposed healing benefits, from repairing gut lining to accelerating muscle and tendon recovery. It's touted in anti-aging and sports medicine circles as a miracle compound. However, BPC is not approved for human use by any regulatory agency, and its safety remains largely unproven. The World Anti-Doping Agency classifies BPC as an unapproved substance, banning its use in sports. Amid the hype, scientists and physicians are raising red flags. Recent research suggests BPC activates cellular pathways that could, in theory, promote cancer spread. This video takes a deep dive into the science, safety data, or lack thereof, legal status, and ethical implications of using or prescribing BPC. I am here to provide a cautionary and evidence-based perspective for both curious patients and physicians. So, where did all this start from? BPC was originally isolated from gastric juice and found to have significant healing effects in animal studies, speeding up wound healing, tendon repair, and even protecting organs from damage. However, many of these studies have not been revalidated. Now, here's what has me a bit concerned, and you should be too. BPC works, at least in part, by activating the FAK-Paxillin pathway in cells. This pathway regulates how cells attach and move, a crucial factor in tissue repair. For example, in tendon fibroblast cells, BPC dramatically increases activation of FAK-Paxillin, leading to more cell migration and survival at injury sites. This pro-migration effect underlies the peptide's healing potential. Essentially, it helps cells move into damaged areas and start rebuilding tissue. This is where a big red flag arises. The same pathways that promote healing can also be hijacked by cancer cells. FAK and Paxillin are well-known players in cancer biology. Aggressive tumors often use FAK signaling to invade surrounding tissue and seed metastases, or tumors that migrate to other parts of the body, like the lungs, brain, liver, and bone. By boosting FAK-Paxillin activity, BPC might unwittingly give any lurking cancer cells a survival or migration advantage. Similarly, BPC is a potent stimulator of angiogenesis, the formation of new blood vessels. Angiogenesis helps heal wounds by improving blood supply, but in cancer, new blood vessels feed tumors and facilitate their spread. A 2023 Pharmaceuticals review pointed out that BPC increases the expression of vascular endothelial growth factor receptor, a key receptor for vascular growth, in animal models. The review warns that these pathways are active in nearly half of all human cancers, from ovarian to melanoma. As one set of researchers bluntly concluded, using BPC may not be the right choice, especially in situations where we are not aware of the presence of cancer cells in our body. Despite the peptide's popularity online, rigorous human trials are almost non-existent. To date, no clinical trial has specifically evaluated BPC's potential to promote tumors or metastasis. The fears are based on mechanism and animal data, not observed human cancer cases, simply because BPC hasn't been studied in humans long enough or in enough people to see those outcomes. Here's what we do know from the few human reports available and why they offer limited reassurance. In 2015, a formal Phase 1 clinical trial on 42 healthy volunteers was initiated to assess BPC's safety and pharmacokinetics. However, the researchers never published the results. The trial was marked as completed, but in 2016, they canceled submission of the results. This is a major red flag for BPC. We don't know if an issue or toxicity was discovered or if it was simply a business decision. The lack of transparency means we still don't have vetted safety data from a controlled trial. One frequently cited quote-unquote study involved 12 patients with knee osteoarthritis or injury who received BPC injections into the knee joint. The authors reported 11 of 12 patients improved in pain. Sounds great, until you see that it was a retrospective chart review with no control group. There were no controls to the types of injuries, the severity of arthritis, or the levels of pain. Just a really poor study design. For a manuscript like this to get into the medical literature, it had to go to a really sketchy journal, as it did. There was no standardized pain score or imaging to measure improvement. Essentially, the clinic administering the peptide, which the patients paid for out of pocket, later phoned patients to ask if they felt better, and wrote up the responses. Not so shockingly, this report was authored by physicians affiliated with a clinic selling BPC injections, presenting a clear conflict of interest. Interestingly, they also obtained the BPC from a compounding pharmacy, tailor-made compounding, that was later fined millions of dollars by the FDA for the sale and manufacture of this compound and bad manufacturing practices. This kind of self-promotional case series does not prove either efficacy or safety. If anything, it underscores the need for independent research and a halting of all of those who try to sell this. The human evidence on BPC is scant and of low quality. The few available human studies are small, unblinded, and often conducted by clinics with a stake in the outcome. There have been no large-scale, long-term studies to truly evaluate safety, especially not for cancer risk. As one medical commentary lamented, the literature on BPC is sparse and fraught with methodological weaknesses, often relying on authors who have a vested interest in promoting the peptide. We simply do not know what happens when a person uses BPC for months or years. Will it cause abnormal cell growth? Will it disrupt normal immune surveillance of tumors? These questions remain unanswered. The only responsible conclusion is that cancer safety is unproven. As I have noted, without comprehensive data, we don't know if use can cause tumors, cancer, or long-term effects on fertility. Until real evidence says otherwise, the default assumption must be that such risks could exist. Let's talk manufacturing and distribution. This is truly the Wild West of compounded peptides. If BPC isn't an FDA-approved drug or supplement, how are people getting it? The answer is largely through compounding pharmacies and gray to black market suppliers. Compounding pharmacies create custom formulations of drugs, typically for patients with specific needs. In the case of BPC, compounders obtain the raw, synthetically made peptide and then prepare it into injectable vials, nasal sprays, or capsules per a doctor's quote-unquote prescription. Clinics and research chemical websites also sell BPC directly to consumers, often labeling it quote-unquote for research use only to skirt laws. Unsuccessfully at that. For several years, this market has boomed in a legal gray area. Doctors would write prescriptions to a compounding pharmacy for BPC and other similar peptides, and patients could receive the drug despite its unapproved status. However, U.S. authorities have started to crack down. In late 2023, the FDA explicitly flagged BPC as an unsafe compound to use in compounding. They added BPC to Category 2 of substances presenting significant safety risks, noting concerns about immune reactions, peptide impurities, and lack of safety data for any human use. The FDA stated it lacks sufficient information to know whether the drug would cause harm when administered to humans. In plain terms, regulators are saying, we have no idea what this stuff might do to people, and we're worried. By flagging it in Category 2, FDA signaled to pharmacies that BPC is not permitted to be compounded under federal law, Section 503A, due to these safety uncertainties. Several other experimental peptides were similarly banned, especially those with hints of protumorigenic effects. In 2020, a notable federal case targeted tailor-made compounding, a Kentucky pharmacy that was a major supplier of peptides nationwide. Tailor-Made and its owner pleaded guilty to distributing unapproved new drugs, including BPC, between 2018 and 2020. According to the Department of Justice, Tailor-Made had to forfeit over $1.7 million in revenue from selling BPC and a slew of other illicit compounds. This case was a wake-up call. It established that selling BPC for human use violates the Food, Drug, and Cosmetic Act and can lead to criminal charges. Other compounding pharmacies have since stopped openly distributing BPC-157, fearing similar action. In the BPC studies mentioned earlier, the peptide was indeed sourced from Tailor-Made during that period. It's worth noting that quality control is a serious concern for the black market BPC. Being unregulated, the peptide vials one buys may be of questionable purity or dosage. The FDA specifically warned about peptide-related impurities and API characterization problems. In other words, that what's in the vial might not be 100% pure BPC, and even if it is, the peptide could degrade or contain variants. Without oversight, patients are essentially guinea pigs, not just to BPC's effects, but also to any contaminants. Sterility is another issue. Since many take BPC by injection, any contamination in the preparation could cause infections or other reactions. A septic reaction in a joint can be devastating to an athlete and end one's career. In summary, the manufacturing and distribution of BPC have been largely underground. The FDA and DOJ now treat it as an illegal drug, and for good reason, given the unknown safety profile. Patients should understand that if they are obtaining BPC, it is not coming from a vetted, FDA-inspected source. It's either a compounder operating in a legal gray zone or an outright black market supplier. This lack of quality assurance only heightens the risks associated with using BPC. Let's talk the ethical and legal implications for doctors and patients. The situation with BPC raises difficult ethical questions in medicine. Doctors swear an oath to, first, do no harm, and are expected to use treatments supported by evidence, or, at minimum, a plausible expectation of benefit outweighing risks. With BPC, the benefits are unproven and the risks unknown, a scenario that challenges the ethical boundaries of clinical practice. Is it ethical for a doctor to prescribe or administer BPC to a patient? Many experts argue it is not. Unlike a sanctioned clinical trial, where experimental drugs can be used under careful monitoring and informed consent under an FDA investigational new drug protocol, offering BPC-157 in routine practice amounts to experimenting on the patient without oversight. As one medical ethics commentary put it, prescribing this compound shows an utter lack of respect for patient health and safety. The same commentary urges patients to run from the doctors recommending this compound, given its unapproved status. From a legal standpoint, a physician who provides BPC outside of a trial could indeed be treading into malpractice territory. Malpractice is determined by whether the physician deviated from the standard of care and caused harm. Currently, the standard of care does not include injecting or prescribing unapproved experimental peptides for injuries. There is no FDA approval or authoritative guideline endorsing BPC use. If a patient were to suffer an adverse outcome potentially linked to BPC, the physician could be found liable for using an unauthorized treatment. In fact, some legal experts suggest that simply prescribing BPC is malpractice per se, since it's impossible to adequately inform a patient of risks that haven't been studied. A strongly worded consumer advisory from one clinic flatly states, "The prescription of this is malpractice, and you could be owed for damages." While that is an opinion, it reflects a growing sentiment that doctors stepping outside the bounds of evidence-based medicine with peptides are leaving themselves exposed to lawsuits. Consider also the issue of informed consent. For a patient to truly consent to a treatment, they need to understand its risks, benefits, and alternatives. With BPC, no one can fully enumerate the risks. Long-term safety data is absent. A doctor might inform the patient that this peptide isn't FDA approved, and we don't have full safety information. But is the patient, especially a layperson desperate for pain relief, really in a position to grasp that they are effectively a test subject? If a serious complication arose, say an immune reaction or a cancer diagnosed down the line, the patient might argue they weren't properly warned because the doctor themselves could not know the risks. This gray area makes patient consent legally and ethically murky. Some patients may not even realize that the peptide injection they received was investigational. Unlike enrolling in a formal clinical trial, which has extensive consent forms explaining experimental status, patients at wellness clinics might assume if a doctor offered it, it must be safe or allowed. Such misunderstandings could lead to feelings of betrayal and litigation if things go wrong. Medical boards are also watching. In Australia, for example, a general practitioner was disciplined and suspended for inappropriately prescribing peptides to patients without sound justification. He admitted that giving those unapproved treatments created a risk of harm and that he failed to properly monitor patients. This case underscores that regulatory bodies consider it professional misconduct to experiment on patients with dubious therapies. In the U.S., state medical boards could similarly sanction physicians for gross deviations from standard care if a complaint is filed. Can a patient sue for being given BPC without explicit approval? Potentially yes, especially if harm results. A patient who develops an illness or injury linked to the peptide could claim negligence or lack of informed consent. Even absent a clear injury, if a patient later learns their doctor subjected them to an unapproved drug without proper disclosure, they might pursue action for breach of trust or battery, unauthorized treatment. While such cases are rare, because thankfully known serious injuries from BPC have not come to light yet, the legal door is open. And if, say, a cancer patient could demonstrate that BPC-157 use accelerated their tumor, a very difficult causal link to prove scientifically, but hypothetically, the liability could be enormous. Physicians must also consider FDA law and malpractice insurance coverage. Prescribing an unapproved new drug outside a trial is technically illegal under the FDCA, aside from narrow compassionate use exceptions. If a physician orders BPC from a compounding pharmacy, they are arguably causing the pharmacy to violate the law, as seen in the tailor-made case, and themselves distributing an unapproved drug. Malpractice insurers might refuse coverage if a claim arises from an activity that is unlawful or outside the scope of standard practice. This would leave the doctor personally on the hook for legal defense and damages. Given all these factors, many in the medical community urge extreme caution. One orthopedic specialist wrote that regulatory agencies must crack down on practitioners and pharmacies that expose patients to unapproved peptides. The consensus among conservative, evidence-driven physicians is that BPC should only be used, if at all, in controlled research settings until its safety is definitively proven. Anything less is not only risky for patients, but also for the clinicians' licenses and livelihoods. BPC exemplifies a modern dilemma, a therapy that is biologically intriguing and hyped by early research, yet lacking the rigorous scrutiny needed to ensure it's safe for human use. On paper, BPC can do amazing things: heal injuries faster, protect organs, reduce inflammation. But biology is complex. When you turn on growth and repair pathways, you may also be lighting a fuse for uncontrolled growth like cancer. The activation of pro-migratory signals and pro-angiogenic factors by BPC is a double-edged sword. Evolutionarily, those processes help us heal and help tumors thrive. Until we know how to separate those effects, using BPC in humans is a gamble with uncertain odds. From a scientific credibility standpoint, the BPC story is riddled with conflicts of interest and gaps in data. Nearly all positive human studies have been small, uncontrolled, and authored by people selling the peptide. The lone phase 1 trial's silence is concerning. Claims that no side effects occur come mostly from the peptide's inventors, rather than independent investigators. Meanwhile, impartial reviews and regulatory analyses highlight what we don't know, essentially everything about long-term safety. Legally, the landscape around BPC has shifted from quietly permissive to actively prohibitive. Federal agencies have effectively pulled BPC out of legal circulation, citing the very uncertainties that should give patients and doctors pause. A doctor who ignores these signals and continues to prescribe or recommend BPC is not just breaking the rules, but potentially betraying patient trust. For patients reading this, it's understandable to be enticed by the promise of a quick fix for chronic pain or a faster injury recovery. But no reputable physician should offer you BPC at this time outside of a clinical trial. If someone does, ask tough questions. Has it been proven safe? What does the FDA say? Why isn't it approved yet? As this article has outlined, the honest answers are troubling. You have every right to be fully informed and to refuse unapproved treatments. Remember that natural, or not a drug, as peptides are sometimes marketed, does not equal safe. Many powerful hormones and growth factors are natural and can also fuel diseases like cancer if misused. For physicians, the message is clear: patient safety and ethical practice must come before hype. Until BPC is backed by solid evidence, prescribing it is a risk to your patient and to your oath. While innovation in medicine is important, it should proceed via clinical trials, not by leapfrogging around regulations and experimenting on those who trust us. There are avenues for compassionate use in truly dire cases, but a middle-aged athlete wanting to speed up tendon healing is not a case of life-threatening need. In less critical scenarios, the safest approach is to wait for data. As painful as it is to tell a patient we don't have a proven therapy, it is far worse to give false hope or possibly cause harm with an unvetted substance. In conclusion, BPC remains a fascinating peptide with potential, but also a potential danger. The links to cancer-related pathways cannot be ignored, and the absence of human safety data is glaring. both legal authorities and medical ethics counsel restraint. Until rigorous studies show that BPC does not awaken any sleeping dragons, like micrometastases, it's best viewed with deep skepticism. This cautionary stance is not anti-innovation. It's pro-safety and pro-science. Medicine has learned hard lessons from past cure-alls that went awry. Let's not add BPC to that list by rushing ahead of the evidence.